Hi there! Welcome to this video for preceptors of Dalhousie University Respiratory Therapy students. We'll talk about the new 2016 National Competency Framework and the new RT student evaluation tools. Please note, this video talks specifically about the 2016 framework, valid until 2021. First, let's talk about the framework. The 2016 National Competency Framework is a two-part framework approved by the Board of Directors or Council of each provincial regulatory body, the CSRT Board of Directors, and the Board of Directors of the National Alliance of Respiratory Therapy regulatory bodies. You can download both parts of the framework on the CSRT website. Part 1 of the framework outlines the national standards of competencies required for entry to practice. This is used for credentialing and licensing. Part 1 also includes the evaluation criteria required for accreditation purposes. Part 2 of the framework provides guidelines for respiratory therapists as they move forward in their career path. This video will focus on Part 1 of the framework. Many different stakeholders will use the framework for a variety of purposes. Educators and accreditation bodies will use it to design and maintain educational programs. Regulators and examiners will use it to build and improve entry to practice assessment tools. Professional RTs will use it throughout their career to help plan and review their professional development. Employers and managers will use it for performance appraisals, continuing education, promotion, and recruitment. Many others will use the framework to learn about the practice and competencies of RTs, including the public, other healthcare professionals, governments, equipment manufacturers, and more. There are many new components in the 2016 framework. Here's an overview of what's new. A list of the attitudes and values expected of all RTs is included, and are also reflected in the statements of competency. Guidelines on the expectations at key stages of the RT's career, and not just at registration or entry to practice, are included in Part 2. Competencies are each expressed with the knowledge they require. The degree of mastery expected at each career stage is shown precisely, and the framework is now competency-based instead of task-based, and now takes a patient-centered approach. This framework is meant to be a living document that will continue to evolve along with the profession, environment, and technology. Over time, the framework will be updated according to consultation with the profession. Your job as a preceptor is to help guide, teach, and assess RT students according to the competencies listed in this framework. We're not going to explain each competency in this video, so please read the framework yourself for more information on each competency. Dalhousie University RT students take part in Clinical Practicum in each year of their study. Therefore, each RT student is expected to meet certain competencies at the level appropriate for their year of study. For example, it's not appropriate to expect a first-year student to master every single competency at the highest level in their first year. This is why evaluation tools have been developed to help the student and preceptor manage expectations based on their year of study. These tools include a poster outlining the competencies appropriate for the student's year of study, a clinical competency logbook to track the experiences earned by the student, and a clinical evaluation form to evaluate the student's performance. Let's go into more detail on these tools. First, posters have been developed listing the clinical learning experiences appropriate for the year of study of your assigned students. These experiences are based on the competencies listed in the framework, and include how often the student should be experiencing them, such as daily, weekly, or if available. Please note, if the student is not able to achieve the expected clinical learning experiences, the professor of record will consult with the clinical coordinator, the clinical site, and the student to develop an action plan to meet the clinical objectives. Copies of these posters will be sent to your site and should be posted in areas seen by both preceptors and students. Next, your student will be carrying a clinical competency logbook with them on every shift. This logbook tracks the number of successful exposures for two different types of competencies, 9 core competencies and 10 clinical competencies. Examples of core competencies include communicating effectively, demonstrating professional behavior, and collaborating with the care team. All elements of core competencies apply to all clinical competencies. Examples of clinical competencies include assessing the patient, managing the airway, and optimizing patient safety. Clinical competencies must be met for all three patient populations: adult, pediatric, and neonate. It's the responsibility of the preceptor to review the student's logbook with the student at the beginning of each shift or learning experience. This reconfirms, for both the preceptor and the student, exactly which competencies have been completed and what the expected clinical learning objectives are for that student. It's the responsibility of the student to present their logbook to the preceptor at the beginning of each clinical shift and to the professor of record at the end of clinical courses and practica. Students are also required to scan the pages of their logbooks that contain fully leveled competencies and upload them to their e-portfolio on the Brightspace learning management system. Each competency is listed in the logbook with blanks to record the level achieved, the preceptor's initials, and the date. Exposures should only be entered into the logbook if they are satisfactory, meaning the student met all the criteria listed in the framework for that competency. Use the alphanumeric code in the logbook to find the competency in the framework. In order to assess and initial an exposure, the preceptor must recall and evaluate all aspects for that competency. For example, did the student properly introduce themselves? Did they confirm proper patient identification? Did the student confirm the physician's orders, gather the appropriate equipment, and communicate effectively with the patient, family, and care team? And finally, did the student accurately and concisely document the therapy or procedure? It's the preceptor's responsibility to assess and initial an exposure under the appropriate level. But what do they each mean? A definition for each of the 4 competency levels can be found at the front of the logbook, but here's a quick rundown. Level 1, or readiness, is when the student knows and is ready to act upon a sequence of steps in a process. They're able to recognize their health and safety abilities and limitations. An example of this is being able to observe an RT setting up an oxygen therapy in a simulated clinical setting. Level 2, or attempting, is when the student can observe and pattern behavior after someone else, following instructions and practicing. They will perform better by practicing. For example, this would include mimicking the setup of an oxygen therapy in a simulated clinical setting. Level 3, or basic proficiency, means the student's responses have become habitual, and the movements can be performed with confidence, precision, and proficiency. This is considered conscious competence. An example would include the student setting up an oxygen therapy in a simulated or actual clinical setting with a respiratory therapist or instructor. Finally, level 4, or full proficiency, means the student performs skillfully using complex integration of concepts. Their proficiency is shown through a timely, accurate, and highly coordinated performance. This level includes performing without hesitation and automatic performance. An example would include a student independently starting, implementing, assessing, and managing an oxygen therapy in an actual clinical setting with minimal supervision. Here are a few things you should know about competency levels. First, the numbers appearing on the individual competency level sheet represent the minimum number of satisfactory exposures required in order to be signed off at that level. Dalhousie University faculty will need to sign off the student at each level before they can begin at the next level. Since levels 1 and 2 are based on simulated clinical settings, students will achieve these levels through lab simulation at Dalhousie University before they arrive at your site. Therefore, they will arrive at your site ready to start at a level 3 competency. Once level 2, 3, or 4 is achieved, the student is expected to maintain and improve on that level for the rest of the program. Failure to do so may result in an unsatisfactory course evaluation. Finally, Students in Clinical Practicum 1500, also known as First Year Clinical, should not be performing any skills at a Level 4 full proficiency in Year 1. Preceptors are also responsible for filling out a clinical evaluation tool after every shift or group of shifts with the student. Please note, this is in addition to the logbook and does not replace it. The top section is for the student to fill in the details of that shift or group of shifts. In the core competencies section, the preceptor indicates whether the student met each core competency. If checking recommended improvement, a comment is required in the section below. Next, the preceptor fills out the Preceptor Feedback for Clinical Competencies section, indicating the student's strengths, areas for improvement, and any other feedback. The leveling guidelines listed in the student's logbook can help guide the preceptor according to that student's year of study. Check off yes or no for the questions listed, and sign and date the bottom. It's important for the preceptor to review the clinical evaluation form with the student to share feedback about their evaluation. Following this review, the student then fills out the Student Feedback Comments box on the back of the page, listing their goals and any feedback. The bottom of the back page is for school faculty only and should not be filled out by the preceptor or student. It's the responsibility of the student to send completed clinical evaluation forms to their professor of record. Here are some resources you might find helpful. You can download the entire 2016 National Competency Framework on the CSRT website. Dalhousie University also offers an online learning module all about precepting health professionals. Finally, if you have any questions about the framework, the RT evaluation tools, or precepting in general, please contact the RT faculty member assigned to your site. Thanks for listening, and happy precepting!